Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Brad Wiening.
And today's episode on Talking with Docs is going to be, when can I drive after I've had my hip or knee replaced?
People ask this all the time, and typically it's the men, and then sometimes it's the women because they're like, I cannot drive with my husband anymore in the passenger seat because he's so annoying.
Well, there you go. And I often ask, well, could you drive before you had your hip or knee replaced?
It's a good question because we do have a significant number of people who are older.
Yeah.
Do you have a valid license? Do you drive?
Yeah.
And then, obviously if they do, what do you tell them?
I think it's variable. Okay, we've looked for the evidence. There's no super duper study out there that checked people driving at 1 week, 2 week, 3
Right.
week, 4 week, and saw how many people got in accidents, and then came up with a scientific answer as to when you can drive. So it is variable. So now we have to rely on a bit more of common sense.
Yes.
So my
Funny thing about common sense, Paul, is that it's not that common.
it's not around. Not often. You'd be surprised how uncommon common sense is. But in any case, I generally start with the 6 week mark.
Okay.
For me, it's 6 weeks, and 6 weeks is kind of an orthopedic unit of measure.
Right.
How long does a bone take to heal? 6 weeks.
Yeah.
How long do I have to wear a cast? 6 weeks. When will I start feeling better after my hip or knee replacement? 6 weeks.
And often relates to our visits too, so that usually that's the second hip or knee
Yeah.
replacement visit is 2 weeks and then 6 weeks. So
it just
around the
seems to be
6 week
one
mark.
of those orthopedic measures of time.
Yes.
So I usually start with about 6 weeks, I'd say.
Okay, so is that for hips and knees?
Yeah,
Same rule.
you
Me
know
too.
what? Same rule. Yeah.
Right side or left side, like driving, because a lot of people are like, Doc, it's not even
Yeah.
it's not my gas pedal leg.
Yeah.
It's an automatic.
Well, what's the big deal? Why can't you just have your hip or knee replaced and then drive home?
Okay, so I'd say a couple things. So one, you're on heavy duty medication for the pain, so
Right.
you're essentially impaired.
Yeah, you're impaired
You're
driver.
impaired. You're an impaired driver.
You're on narcotics.
So that's the first reason. My second reason is your ability to react. And even if it's the non-operative leg, even if you're not on medication but you are distracted by pain or a swollen leg that's hard to move, or that foot gets stuck under the brake instead of the gas,
Yeah.
I mean, there are a lot of factors that can actually reduce your ability to drive a vehicle.
Yeah, you're distracted by the pain you're in.
Yes.
So how are you going to roll down the window and yell at the person next to you if you're in so much pain, right?
Yeah.
So that,
Yeah.
and you have impaired function of
Yes.
that limb. If you probably have a big dressing on, or if you haven't got your range of motion back for your knee or your hip,
Yeah.
you just won't be able to function well enough to use the pedals.
And your reaction time for that reason, for the medication reason, as well as the muscle function reason, is you can't react fast enough. And I always tell my patients, I say, listen, theoretically, if you had to drive away from a burning building, could you get in your car and drive away like a week after surgery? You probably could. However,
Burning building?
like like I say, like in a movie, and it's going to explode. You got to
Yeah.
get away.
Yeah.
Like get in the car. We got to go.
Yeah.
But I just had surgery.
Yeah.
Too bad. You could do it.
Yeah.
But what I also tell people is that if you do get in an accident, unfortunately, medical legally, I tell my patients that the guy who finished last in his law school class probably can win this case.
Yeah.
It's like
Yeah.
easy. So it's a moral and a legal decision, I think.
We don't mean to offend anyone who finished last in their law school
You know what?
class.
You got into law
You
school,
got-
and I
you
think
passed.
that's
You
important.
passed. You know what I mean?
You passed the bar.
You got your degree.
The other thing that I tell people is imagine if a small child ran out in front of you, and this is more serious, that you need to be able to slam on the brakes really quickly, and because you would never forgive yourself, plus obviously it would be a horrible thing.
Devastation.
So that's why we tell people not to drive. And we recognize that it is very inconvenient. Losing your independence and inability to drive to your own physio, come to your doctor's appointments, get your groceries, whatever, it's hard. But
Okay, so that's for a hip or knee replacement.
Yeah.
Broke my wrist, got a cast on. Can I drive?
whoa, we're going there. Okay.
Yeah, let's go.
So I tell people no, because same reason. Like if I see you and I think if you hit me and you come out of the car to trade licenses and you got a cast in your wrist, I'm like,
Yeah, it's your fault.
even if it was my fault, because you can't turn
Yeah.
a wheel properly with one hand.
No, cast on the wheel doesn't work.
Yeah. Nope.
Ankle fracture, wearing
Same
a
thing.
boot.
Well, and actually, there's some studies that show. There's one specific study that I remember from residency that said braking time was like 9 weeks.
Really?
Yes.
For an ankle fracture?
For ankle fracture.
Braking time meaning applying
Your
the brake.
ability to apply the brake and brake in a normal fashion. It
Yeah.
took 9 weeks to get back to normal.
To apply the brake with your broken leg.
Yeah.
Right. Yeah, okay, so there you go.
So be glad it's only 6.
Yeah.
But having said that,
Yeah.
in some people, I guess it could be 5. In some people, it might be 8 or might be 9, or might
Yeah.
be 12.
Yeah.
So if you're unsure, I tell people, A, talk to your doctor, and B, the first time you do it, go to an empty parking lot with your spouse or your partner or a friend or whatever, and try to slam on the brake. And if you can't do it, then wait another week.
Yeah, yeah. And once you get in and discuss it with your doctor, try not to approach it like you're buying a used car. It's not like a haggling deal here where we're like, well, I'm going to give you credit for the 1 week you're at home and in the hospital, and we're going to, you know, it's not a haggle. It's sort of trying to arrive at a common sense answer.
Yeah.
Which, you know, which can be tricky, and it's variable and subjective because we don't have great evidence.
Yeah. Because everybody's different too, so different.
Yeah, yeah. So really, it's for your own safety, and that period of time will end eventually. So we really need our patients to be patient, and 6 weeks is sort of a starting point for the discussion.
And to your previous point, I do tell a lot of my patients, I say, oh, I'm sorry, I'm not sure why you thought this was a negotiation, because they do come in and go like, okay, well, what about 4 or 4.5?
Yeah.
No, 6.
It's the haggling, like you're trying to buy or sell or barter.
So most importantly, we only want this because we want everyone to be safe. We don't want anyone to get an unnecessary accident. So,
and unfortunately, I don't think the Department of Motor Vehicles is seeing a ton of accidents caused by people after they've had their hip or knee replacement.
Agreed.
There may be, I mean, I'm not a police officer, but there may be a lot of accidents that are occurring with other sort of more minor injuries and stuff like that. But in any case, use common sense, try and listen to your doctor, and just remember, there's no hard and fast right answer. Like Dr. Winnie said, everybody's different.
And so if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.